Okay, this is part 2 of the high blood pressure solution by Richard Moore. This is a book review. I just did part 1 yesterday, so if you haven't seen that, it'd be helpful for you to see that. Here's a paper about the Yanomami Indians in the Amazon jungle by Venezuela and Brazil. They have no hypertension their entire life. They'll have the same blood pressure when they're a child, like a newborn baby, as adults, like 95/60. They tested their urine. There was close to zero sodium in their urine, and the point being that the kidney is made to conserve sodium. It's made to excrete potassium, so it's really good at that, which is another indicator. We're made to eat a lot of potassium as in plants, and we're not usually going to get that much sodium in our wild, natural environments. Their blood pressures don't go higher as they get older. Okay, so that's the Yanomamo. Oh, another thing interesting about them, they tend to be very kind of wild and violent. They're fighting with the other tribes out there, and they'll often try to capture the women and all this type of stuff. A lot of them die in violent death, fighting between each other. The reason I mention that is despite all their stress, they've gone out and studied them rather extensively. They don't have hypertension. What I'm trying to say is diet is more important than stress as far as hypertension has been concerned. And as far as health is concerned, don't get me wrong, stress can be a big deal. And I think for Western Americans and whatnot, they've got a lot of problems already, and the stress adds to it. But for these people and for other populations like the rationing populations, World War I, World War II, the diet was more important than the stress, even though the stress, of course, is important. I think Americans nowadays have problems coming from so many different directions. The stress just is the last straw that broke the camel's back, so to speak. Okay, here's the windkessel effect. Windkessel is like the thing, it looks like a miniature accordion that you blow air on the kindling to start the fire. And so what basically happens here is when the left ventricle contracts, then blood goes into the ascending thoracic aorta. That is stretched outward. It has elastic fibers that recoil inward during diastole. Systole means contraction in Greek. Diastole means relaxation. So during diastole, the elastic fibers have elastic recoil inward, and that propels blood up to the brain and to the rest of the body through the aorta. The aorta, of course, looks like a candy cane. Okay, so that's how you maintain diastolic flow. You can't replace these fibers, the elastic fibers in the ascending thoracic aorta, after the age of maturity. Let's say your 20s. So if somebody's hypertensive for a couple of decades, let's say from 20 to 40, they'll lose these elastic fibers, ascending thoracic aorta, which is like losing a second heart. And because of that, they won't get much diastolic flow. And to compensate, they'll have to have more systolic flow. And you want to remember, too, the coronaries are perfused during diastole, because during systole, while the left ventricle is contracted, the intramyocardial branches really can't get in there significantly. So when you reduce diastolic flow, you're also reducing coronary artery perfusion. Not good. Okay, here's some more, a little bit more detail from this book here. I'll see, maybe I can go into a full view thing here. Let's see if I can go into full screen interfaces. Does that make it easier? Okay, when you increase K factor, you reduce, that means the ratio of potassium to sodium. You'll reduce the risk of stroke and hypertension and the risk of diabetes. That's a big deal, especially the risk of stroke is markedly reduced by improving your K factor. Even if you don't control the hypertension, your risk of stroke is markedly improved. So that's good to know. Okay, let me get in the corner or something hide here. It's not so much the absolute amount of sodium that matters, but the ratio of sodium to potassium. I think why it's such a big deal to get sodium down low, and Kempner talked about a threshold effect, is that the lower the sodium is, the higher it is to get multiples of sodium on your K factor. It's just much easier. It's much easier to get multiple potassium multiples of 200 milligrams a day of sodium than it is 1,000 milligrams a day of sodium. Okay. Then an interesting story about black people. Black people in the USA have hypertension off the charts. But the problem wasn't the fact that they were eating too much sodium. They were eating less sodium than the whites. Both of them were eating too much sodium. The problem is that they weren't eating any plants, hardly any plants. And so they had very low potassium. And that's associated with dramatically high incidence of hypertension, often severe hypertension. Like I said, they're 18 times more likely to get hypertension-related kidney failure. You just walk into any dialysis unit, be surprised how many black men that aren't that old are in kidney failure. And so what do they need to do? They need to eat more plant foods. P for plants, P for potassium. Plants are also where you get magnesium. It's right in the center of chlorophyll. Kempner's diet of rice, fruit, and vegetables had a very high K factor. I think he quoted it as probably being around 16. Drugs might lower blood pressure, but they really don't fix the cytoplasm K factor, and they don't significantly reduce the risk of stroke. So drugs are quite overrated for hypertension. It's like, why not get the real deal and eat the plants, get the potassium? Okay, an aggressive treatment of borderline hypertension can increase the risk of death. Yeah, if you over-treat hypertension, you could have a stroke, you could pass out, feel dizzy. In order to prevent one stroke, you have to treat 850 patients with mild hypertension. So that means you have a less than 1 in 100. It's getting up close to 1 out of 1,000 chance of preventing a stroke if you medicate for that. But it'll cause tons and tons of side effects. Lots of guys will get impotent and have all kinds of other problems from those drugs. So, I mean, why wouldn't you just fix it with the diet? That'd be the smart thing to do. The reason K factor is so important because it controls the electrical system of your cells. The potassium-sodium pump, it's an electrical generator for pumping everything on that cell membrane. And we're going to talk about some of the consequences. They're surprisingly bad. The current's carried outward by the net movement of positive charge of sodium ions. We talked about all this in the first lecture. Charge separation across the plasma membrane is, your voltage. And then you can open up that sodium channel to generate a useful current, and it is the power for electrical chemical gradient generated by that sodium-potassium pump is the power for running your other pumps of your plasma membrane. And remember Bruce Lipton's talk, the plasma membrane is the brain of the cell. The DNA is just a blueprint, and what I'm trying to say is you want your plasma membrane working well, because if it's not, you're not going to be that healthy. Okay, in general, you're going to pump out 3 sodiums for every 2 potassium brought in, meaning more positive charge is going out. So a net outward positive charge from all those sodiums being pumped out. Okay, the amount of sodium and potassium inside a cell is held constant. So it's about 98%, a little more than 98% of the positively charged ions, the cations. So it's always going to be the same. If sodium goes up, potassium goes down. If potassium goes up, sodium goes down, like a teeter-totter. It's never, you can't add both to the cell, because otherwise you'd have osmotic swelling. So that's an important point. And later on, he's going to say towards the end of the book, there's no way around this. You either eat correctly and get a lot of potassium relative to sodium, or all your cells are going to be functioning suboptimal. There's no drug for this. Okay? This is another reason why it's kind of amazing when you actually study what happens when people improve their diet. It improves a whole bunch of things, and the reason is it improves cellular function in every cell and every organ system. Okay? When the pump slows down, you get more sodium inside the cell. Okay? Because your pump is not pumping that sodium out as quickly as it normally does. When you get more sodium inside the cell, you weaken your electrical chemical gradient, then you're less able to pump calcium outside the cell. You got to remember, calcium wants in. It's 10,000 times higher in the extracellular matrix. So it wants in. And if you can't pump it out quickly, you start accumulating calcium inside the cell. And this happens in almost all the cells of the body. You don't want that because it activates cells that you don't want activated. It activates the vascular smooth muscle cells and gets them to tonically contract. And then you get vasoconstriction, narrowing of your arteries. Then you get decreased blood perfusion in your tissues, including in your skeletal muscle. Lack of skeletal muscle perfusion causes increased insulin resistance, increases your risk of diabetes. Hypertension and diabetes, they go together. Richard Moore had a great quote. He calls them 2 sides of the same coin. And we're going to see there's other things that make them interlocked. So you're going to have a hard time getting away with just having one or the other. The vast majority of patients that have them have both. You start out pre-diabetes. It takes a while to ramp up to full diabetes, but the typical patient is eating the diet that causes both of these. Okay, to prevent hypertension, a person should eat 100% unprocessed foods, as unprocessed as possible, and lots of fruits and vegetables. They're very high in potassium and low in sodium. You should not add table salt to your food, NaCl, sodium chloride, which is like the worst form of salt in the sense that it's the one that causes the most sodium retention in the body. You can replace it with a salt substitute that's 60 to 70% potassium, like they did in Finland from around 1970 to 1990 with Pekka Puska was a doctor leading that program. High blood pressure solution book was severely banned. When this book came out, it was like an immediate bestseller, sold 14,000 copies like the first month, and then the drug company said, oh, no. They went to the publisher, had the book banned. And then they had the publisher, they paid the publisher to publish something that said how great drugs are for treating hypertension. Welcome to the real world. Okay, here's a chart. I thought this chart was kind of fun, where I went through the K factor of a whole bunch of different foods. So I'll try to get myself out of here. I'll get myself off this chart because this is a good print screen thing. Okay, so if you look at your fruits, bananas are about 450 to 1 K factor. That's not a misprint. 450 to 1 on the K factor. This is why your kidneys have to be so good at excreting potassium, and we're made to do this. Watermelon, 270 to 1. An orange, 250, K factor 250. Strawberries, 170. Raspberries, 150. Apples, also 150. Steel cut oats, about 160. Blueberries, 110 to 120. You'll sometimes get different numbers for different books on the K factor. So another one said watermelon K factor 100. This one says 270. Cherries, 96. Pear, 71. So these are extraordinarily high numbers. You know, the author of the book, Richard Moore, says you wanted a minimum of 5, but it's better to have it higher. He says our ancestors had it around 16, and I bet it's more like around 20. I don't think he's as familiar with ancestral diets as I am from studying it. White rice, K factor about 60. Brown rice, K factor about the same thing, 50. Jasmine rice, K factor 35. White rice, a type of white rice. Green beans, 40. Peas, 50. Lentils, 50. So what you're seeing is a pattern. Your fruits tend to be anywhere from 100 to 450, so over 100. Your starches tend to be, in this range of about 50 to 60. Now, some of them, again, it's not exactly clear where it's at, like potatoes. One paper I read, gave it a K factor of 40. Another paper gave it a K factor of 130. Richard Moore thinks that potatoes are fantastic. He gives them a K factor of 130 in his book. I looked at Richard Moore's book, and I also looked at some papers to get a sense of these K factors. And by the way, there's a whole bunch of papers showing that this is true, this idea of eating more potassium than sodium and the ratio of the two. Throughout his book, he has tons and tons of citations. The guy was a formal research scientist for many, many years. Okay, our ancestors had a K factor of 15 to 20 according to the book. Arugula salad, about 15. Another chart here says sweet potatoes of about 14. Iceberg lettuce, 12. Cauliflower, 10. Beet juice, 7. Carrots, 5. Ground beef is about 4. So meat is not that bad. You'll tend to have a K factor around 4 or 4.5. So a population that eats a lot of meat might still have not that bad of a blood pressure. I'm not that enthusiastic about meat, though, because of all the sad fat in the blood sludge. I can also tell you, McDougall and Pritikin felt the biggest cause of hypertension was the blood sludge from the fat, versus other people like this author think the biggest cause is the low K factor ratio of sodium to potassium to sodium. So you want high potassium to prevent high blood pressure. Eggs have a K factor of 1.1, soy burger 1.6, Cheerios cereal 1.2, Cheetos 0.14, so less than 1, pretty bad. Potato chips 0.9, and this one I thought was surprisingly bad, Special K cereal 0.06. So it's got all these vitamins in it because they add those to it, but intrinsically it ain't doing so well. But a K factor of less than 1, that's terrible. And also, you see the pattern. The best K factor foods are the fruits, then the starches, then the veggies. And then the animal foods are sort of not so good, so. And the processed foods are terrible. That's a good indicator of food is processed. Just look at the nutrient label. And if the nutrient label says it's got more sodium than potassium, I wouldn't eat it. I would never eat it. That means it's real processed. And the reason why you got higher potassium in the cells is because the plant cells also have a lot more potassium inside of them. That's characteristic of plants and animals. Okay, here's a little bit about insulin levels. Normal insulin levels in the blood, 2 to 25, okay, in a healthy person. Somebody who's got insulin resistance, you're now talking while they're fasting, 25 to 50, so they've more than doubled for many of them. All right, so I want you to get that in mind, that they can double pretty easily. Okay, and this is more about insulin resistance patients. They can have them pretty high. Okay. All right, I show you this because I'm going to show you some significance of that in a moment here. So now we're going to talk, everything's a little bit in yellow here, highlighted. I'm going to specifically talk about some of the relationships between hypertension and diabetes. You might want to screen save this slide. It's a pretty interesting stuff that Richard Moore came up with. This is not well known in the medical community. He said insulin resistance and hypertension are two sides of the same coin. I got the page numbers here too, so if you want to buy the book, the page numbers are all here. You can check all this stuff. High calcium inside of cells causes insulin resistance, okay? Increased cytoplasm calcium is associated with decreased cytoplasm magnesium. There's a little bit of a, just like there's a reciprocal relationship between sodium and potassium, there's a bit of a reciprocal relationship between calcium and magnesium. When cytoplasm calcium goes up, magnesium has a tendency to decrease. And you don't want that. High calcium in a cell will cause the pancreas to secrete more insulin. It'll also cause other cells to become a little bit more insulin resistant. It's bad. This is starting to push you towards diabetes. Okay, and elevated insulin causes the kidneys to retain more sodium. And it's a vicious cycle because it's very potent at causing the kidneys to retain more sodium. And when insulin levels in the blood are doubled, let's say you went from a healthy insulin level of 20 to an unhealthy level of 40, that can cause almost total reabsorption of sodium from the preformed urine in the kidney, okay, in the kidney tubule after it's gone through the glomerulus. And what that means is you're going to increase your volume, you're going to increase your blood pressure. This is an example of how they go together. And what you're seeing here is diabetes causes hypertension, hypertension causes diabetes, and they self-reinforce each other, and that's why most patients have both of them. This is another reason to help explain why high-fat meals also cause hypertension. Okay, any fat that causes insulin resistance is going to cause hypertension. Elevated blood insulin level causes cytoplasm pH to go up. It gets the cell to pump more protons, more acid out of the cell. So the cytoplasm protons goes down, so its pH goes up, becomes more alkaline, but the extracellular matrix is acidified, and the cell becomes more mitogenic. Do you see where this is going? Do you understand what he's basically saying? So mitogenic means for a cell to divide. Acidification of the matrix means that it's the extracellular matrix. That means extracellular space. So what he's saying here, this is profound. He's saying that when you have elevated blood insulin levels, it makes the cells behave more like cancer. This is characteristic of cancer, to pump acid into the extracellular space, acidifying the area around it. It's called extracellular acidification. And what does that do? That paralyzes the immune system. So that's why a cancer cell can persist. One of the things it does is it shuts off the immune system. So you can see the double whammy here. The fat itself intrinsically has a suppressive effect on the immune system. And then on top of it, the high sodium, low potassium diet causes additional extracellular acidification that suppresses the immune system. It's like shuts the immune system off so it can't remove the cancer. And simultaneously, this combination makes the cell more mitogenic, meaning gets the cell to replicate, to divide, puts it into a biosynthesis mode so it can replicate. You understand how this is all bad? So what am I saying here? The same thing. The high-fat, high-sodium diet causes hypertension, and it causes diabetes, and here we're showing how it causes cancer. It increases cancer risk. Okay, that's profoundly important right there. And that's why the same diet pushes towards all the same diseases, the two gateway diseases, hypertension and diabetes, pushing to atherosclerosis. They're also pushing to cancer. They're also associated with leaky gut and all the autoimmune diseases. They're also associated with low dietary fiber and abdominal pressure syndrome. That's most of the chronic diseases, because when you include atherosclerosis, you're talking about stroke, you're talking about atrial fibrillation of the heart, congestive heart failure, heart attack, all this stuff, all these cancers. So it's all interconnected. It's all bad. Like Pritikin had said, fat is bad. Like McDougall had said, fat is the biggest toxin in the Western diet. Okay? All right, and the feeling is, by a lot of people, saturated fat is worse. Okay, saturated fat is worse, causes the most insulin resistance, the most elevation of triglyceride of LDL cholesterol. But, look at Yamashima. He says the omega-6 cooking oils are the worst. He says they're a disaster. Look at Chris Knob. Omega-6 cooking oils are the worst. They cause more blood sludging, and they go down the Yamashima theory of lipid peroxidation with subsequent injury to cells, increased risk of destroys pancreas beta cells in the pancreas, causes insulin, destroys brain cells in the arcuate nucleus of the hypothalamus, gets people to eat more. So what I'm trying to say is, Omega-6 cooking oils are screwed. And then omega-3, a little bit better than the other two, but they still got a lot of problems. They increase the risk of atrial fibrillation, okay? If you take them as a supplement form, there's concern they're substituting out for the mitochondria, cardiolipin, fatty acids, and that's a problem. They increase risk of prostate cancer. They cause increased risk of metastatic disease in animal studies that McDougall would always talk about. So anyways, I think you want to minimize your dietary fat. Give yourself the best chance to reverse your atherosclerosis and help with your other problems. But I thought this was profoundly interesting, that it's showing how it's all connected. These vicious cycles just connect all these diseases and make the patient keep getting worse. Okay, what else is interesting? In a diabetic animal, the level of sodium inside the cell is increased. Yep, and then the insulin resistance means resistance to glucose uptake of skeletal muscle. Just because you're resistant to glucose uptake in skeletal muscle doesn't mean you're resistant to the other effects of insulin. And Richard Moore felt it was important to recognize hypertension is a syndrome, like metabolic syndrome, associated with high blood insulin. We talked about how that causes retention of sodium, high blood triglycerides and VLDL, very low density lipoprotein. And these also cause blood sludge, especially, your triglycerides cause blood sludge. Chylomicrons cause blood sludge. Elevated LDL cholesterol causes blood sludge. Elevated insulin levels cause increased pumping of protons out of cells, acidification in extracellular space, and this is mitogenic for the cell. It gets it to divide. So it pushes towards cancer. And then it also causes thickening of the arterial walls. So they get thickened both from the effects of the hypertension itself, in terms of vascular smooth muscle hypertrophy, but also the elevated insulin levels contribute to it. You're going to get more glycation, advanced glycation end products, thickening of the capillary basement membrane. You also get more collagen laid down along the wall of the artery, so it loses its elastic properties, and that's hardening of the arteries, arteriosclerosis. Okay, increased cytoplasm calcium levels cause increased insulin resistance. We talked about that also causes pumping out more protons in the extracellular space. With a higher K factor, you get less sympathetic autonomic nervous system activation. Otherwise, you're going to activate SANS from the high blood insulin levels, and that's going to cause increased renin secretion by the kidney. That's a hormone, and that's going to increase aldosterone and angiotensin too. So you're going to get more vasoconstriction. That's going to raise blood pressure. So that's a vicious cycle, for example. Okay, so I thought that was pretty interesting. That way these diseases are all tied together. You can't escape them so easy. Here's a picture of what I was talking about, make it a little more concrete. Is that here's a normal capillary. The red blood cells are going through. The background is the endothelial cells. They're shaped like a spindle along the long axis of the direction of flow. RBCs are 7 microns. Capillaries are 5 microns. Because the capillary is smaller, the RBC has to fold back on itself to pass through. Like you can see it folded back on itself a little bit. And then these blue circles are the oxygen going through the capillary wall, the capillary basement membrane in yellow, the vascular smooth muscle cells in green, and then the blue oxygen goes to the neuron. All right. But when you've got diabetes and hypertension, you're going to get from the diabetes thickening of the capillary basement membrane. From the hypertension, you're going to get thickening of the muscle wall along the blood vessels or the pericytes in the brain. And that thickening of the wall makes it harder to deliver oxygen. You'll also get laying down of collagen with chronic hypertension. So that's all bad. That all means less oxygen is going to get to the cell, which means you're going to have lower levels of function. Okay, here's other things that cause hypertension. Besides having a low K factor, being deficient in magnesium and potassium, and having excess dietary sodium. Lack of exercise increases your likelihood of hypertension. Alcohol does. It also makes the plasma membrane leaky to sodium, so it pushes a similar effect. It also predisposes to fatty liver and diabetes. Obesity. Water softeners will put back more sodium into the water quite often, not good. And they can also sometimes remove magnesium. That's why I didn't get one at my old house. Magnesium deficiency. Hypertension patients tend to have about 25% lower levels of intracellular free magnesium. That's bad. Dietary shortage of potassium because they don't eat plants. Excess dietary sodium. And the chloride also is important because the chloride helps to reabsorb the sodium from the kidneys. So the worst form of dietary sodium is in the form of sodium chloride. Stress makes things worse and causes loss of magnesium in the urine. When your magnesium is depleted, your ATP reactions aren't going to work well. And it also makes it harder to restore your potassium levels. I forget the exact reason for that, but if you don't have relatively normal magnesium, you won't be able to just eat or supplement that easy to get your potassium back up. It'll be refractory to improvement. Being in the cold can raise your blood pressure. Secondary hypertension, things like renal artery stenosis from atherosclerosis, or some rare tumors, pheochromocytoma. Okay, pheochromocytoma, I've seen one in the last 30 years. Okay, so I wouldn't worry about that being your diagnosis. I see a bunch of hypertension patients every day. Cushing's syndrome is really, really rare as well. Corticosteroid medications are a lot more common. Primary aldosteronism, oral contraceptive pills, reaction to decongestants, aortic regurg, severe anemia, those are other possibilities, thyrotoxicosis. Okay, a couple of little things here, not too much more. We got through the main part of this talk here. And what was interesting, plant cells are like human cells with a lot of potassium inside, so that's why you get lots of K factor when you eat plants. Sweat glands are like miniature kidneys. I thought that was a cool little concept. A sweat gland's like a miniature kidney. It made me wonder if dialysis patients could sweat off some of their fluid weight. When the body sodium is low, the sweat glands will sweat out less sodium in the sweat. Unsalted meat, so the unprocessed, grass-fed, whatever, they got a K factor typically of about 4.5. So you could have an okay blood pressure on a high meat diet initially, and that's what he thinks, but I actually think he's a little wrong about that because he's going to get the blood sludge effect. So you have to factor in what's the amount of fat on the meat. The required amount of sodium is probably as low as 100 to 300 milligrams for a community, but Kempner put his patients as low as 50 to 60 milligrams per day. And the low blood pressure primitive populations, they would get their sodiums as low as 50 to 230. So we're capable of handling that. Okay, we talked about the sodium-potassium exchanger. It brings 3 sodium into the cell and pumps out 2 potassium. We already kind of covered all this. Okay. Calcium inside the cell activates sympathetic cells and gets them to cause contraction of the vascular smooth muscle cells. Increasing dietary potassium always causes loss of sodium and vice versa. It's always like a seesaw. Okay, vascular smooth hypertrophy and proliferation is gradually reversible, but the collagen probably is not. So you want to get your hypertension treated the sooner the better before you get irreversible damage to your blood vessels. And also, even if you treat it, even if you don't get much of a change in blood pressure, you'll get, just by fixing your plasma membrane gradients, you'll significantly lower your risk of stroke. And if you treat it with drugs, you don't get anywhere near as much benefit. Okay, this is a big Finland study. They had a 62% drop in mortality very rapidly. That's great. We talked about this previously, the Donison paper in the Lancet, 1929, how the blacks are eating a plant-based diet. They don't have any hypertension, zero, none, nada. Okay, whereas the ones that eat in the processed food, hypertension off the charts. Okay, that's the end of part 2, and that's the end of this book review about the high blood pressure solution by Richard Moore. I hope you found that helpful. I thought it was quite interesting, especially the way the hypertension and the diabetes were so interlocked. There's like no easy way around it. And he says in his book, he says, look, you do whatever you want, but if you want to be healthy, you should eat a K factor of potassium relative to sodium, at least 5. Like I said, ancestrally, I would say you want to be at least 10, more towards 15. Okay, but it's nice to know there's something you could do. You're not inevitably screwed. It's a fixable problem. The sooner you get fixing it, the better.